It's 3 in the morning. You've been staring at the digital clock on the nightstand, waiting for permission to feed your crying newborn. You read the books, you downloaded the apps, and they all promised a predictable routine. But the baby isn't cooperating. First-time parents are often told that a strict feeding timetable is the only way to bring order to the home. Yet a healthy newborn operates entirely on survival instincts, completely ignoring the intervals we try to map out for them. This leaves sleep-deprived parents staring into the dark, wondering why their baby seems to be hungry every single hour. This relentless cycle is not a sign you are failing. Frequent nursing is a biological necessity. It delivers vital early nutrients to the infant, and critically, it signals the parent's body to ramp up milk production. Trying to force a newborn to wait 3 or 4 hours between meals ignores the actual physical size of the child's digestive system. To understand why babies eat so often, we have to look at gastric catacity, the rapidly changing physical size of the newborn's stomach. This single metric dictates exactly how much and how often an infant can safely consume. This diagram illustrates an infant's stomach on day 1. It is only the size of a cherry. It can hold a mere 5 to 7 milliliters, roughly 1 teaspoon, of thick, nutrient-dense colostrum per feeding. By the second day, that capacity expands to the size of a walnut. The volume it can handle increases slightly, maxing out at around 27 milliliters. Fast forward to day 7, and the stomach reaches the size of an apricot. Now it can safely process between 1 to 2 ounces of milk at a time. By the end of the first month, the stomach equals the size of a large egg. At this stage, the infant can finally tolerate 3 to 4 ounces in a single sitting. Because these early volumes are so small, the math is straightforward. Breastfed babies need to eat 8 to 12 times a day to get enough calories. Formula-fed babies digest slightly slower, meaning they eat 6 to 10 times a day. The digestive system simply cannot hold enough liquid to last long stretches. Small, frequent feeds are anatomically required, making long gaps between meals impossible in those early weeks. The clinical alternative to watching the clock is called responsive feeding, or feeding on demand. Instead of setting timers, caregivers learn to read a language of physical cues. A hungry infant starts communicating long before making a sound. They will become more alert, bringing their tiny fists to their mouth, smacking their lips, and turning their head from side to side in a motion known as rooting. Crying is actually a late-stage distress signal. By the time tears are falling, the baby has already been hungry for a while. They also signal when they are done. A full baby will close their mouth, relax their hands, and turn their head away from the breast or bottle. Recognizing these stop signals helps prevent overfeeding, which is especially common with bottle-fed infants. Catching those early hunger motions allows you to feed a calm infant. A relaxed baby latches easier, feeds more efficiently, and swallows less air, avoiding painful gas later. Throwing away the strict timetable introduces a new anxiety. If you aren't measuring exact ounces or tracking minutes on a spreadsheet, how do you know the baby is actually getting enough food? The most reliable, objective metric for infant hydration and nutritional intake is actually found in the diaper. This image shows what you should expect on day 1. The stool is a dark black, tar-like substance called meconium. It looks alarming, but it confirms the newborn's digestive tract is working exactly as it should. This second image illustrates the transition around days 3 and 4. As breast milk or formula moves fully through the system, the stool shifts to a greenish-yellow, seedy texture. Finally, this image shows the day 5 standard. The stool becomes a bright yellow. Combined with pale yellow urine and a target of at least 6 wet diapers a day, you have a clear indicator of success. Tracking this daily output provides a consistent window into a baby's health. It replaces the anxiety of guessing feeding volumes with tangible proof that your child is nourished. Just as you settle into a comfortable rhythm, the pattern will break. Around weeks 2, 3, and 6, babies hit biological growth spurts. they will suddenly want to feed constantly, a behavior called cluster feeding that shatters the routine you just built. But this chaotic, around-the-clock newborn phase is strictly temporary. As their stomach grows, the volume of milk they can hold increases. The feeds naturally space out, and sleep eventually returns. Trusting biological signals over an arbitrary clock removes the constant pressure of the schedule, letting you navigate the newborn phase by simply responding to your baby's needs.